Anytime we're pursuing something, life does not just say, oh, we're gonna take a break while you pursue that. We'll come check back with you when you're done. Life said, oh, we're gonna crank it up.
I'm telling you, and so many people told me like, well, maybe you should just stop. Like, maybe this not your season. I kept going because it's always my season. And I love a challenge. You tell me I can't do something, bet noted. And don't let people talk you out of it, like, because they will. They will. People say, oh, I make more as a nurse than a nurse practitioner. And that may be true at first. You gotta think about the long run. 2-3 years in the game, you're gonna be making more than you was as a nurse, and you're not gonna have to kill yourself doing it.
What's going on, y'all? This Shanice with the Bedside Report. And I'm so excited today. You know, the Bedside Report, we are a podcast community that basically shines the light on Black and brown nurses. So I'm excited today because I got somebody special in the house. We got Bri, the MP. What's up, Bri?
Hey.
So glad you're here, girl.
Thank you for having me.
For sure. So just to kick it off though, Bri, you remember how we met?
Yeah.
I met Bri at a gas station.
She walked up on me. That's exactly what it was. She walked up on me and said, hey, I see your nurse tag. Are you a nurse? And I was like, yeah. Because I'm just kind of not friendly like that. No, but I was
go for my friendly self.
yeah. She was like, yeah, but I was kind of like, but then she was friendly. So I was like, okay, I cannot be a
Well, you covered it up good because I wouldn't have thought that. Like, you kind of felt like, why this girl talking to me? Kinda.
Yeah, a little bit.
Okay.
Yeah.
But no, for real, I mean, I saw the nurse tag, and I ain't gonna lie, I got a nurse tag, and I actually hate that I do.
I know.
You don't?
We tried them tickets. I got out on one the other day. I was going 20 over. Got me out of there with a warning.
Oh, yeah, because you supposed to be in jail.
Mm-hmm.
Okay.
Keep it.
Because I thought about covering that thing up and everything. No?
You need it.
I need it. Okay, I keep it, but anyway, yeah, that's how we connected. Because I'm like, you know, I'm thinking, of course, like she said, I can be very friendly. And I was just like, oh, I'm seeing a sister with a tag. Okay, you know, the nurse connection. I didn't even know she felt that way to today. So she just told on herself.
Yeah.
But anyway, but nah, it's cool. I think I said, you know, you on Instagram and yeah, start following her. That's probably been, I don't know, probably 4 or 5 months ago. But after that, just been following. Then I hit her up a few days ago. I was like, hey, I'm be in town. Let me interview you because I see you doing big things, you know. You're a nurse practitioner, right?
Yeah.
So I ain't gonna tell your story.
Okay.
So just kind of tell us like how you got started in nursing. You know, just give an introduction of who you are.
So I'm Bri, and I'm 34 years old. I'm a mom first. I have 3 kids. And so what made me want to become a nurse was actually my mom had got one of her kidneys removed, right?
Okay.
And so she had like bandages and like a scar and a dressing like that had to be changed. But I was like in middle school.
Oh,
So like when I first seen it, I literally busted into tears, and I ran out of the room. And it hurt her feelings. She started crying. It was
because you left.
Yes. And so like when I gathered myself back together, like pulled it together, she was in there trying to do it herself and couldn't do it. So I did it. And then it was like fun. I'm like, yeah, I'm your nurse now. So like that's really what did it. Like I love helping people. Honestly, that's what started it. I was like, yeah, I'm gonna be a nurse.
And that was at 12 years old.
That was, yeah.
Wow. So you knew at that age you were gonna be a nurse.
I knew I was gonna be something to help somebody.
Helping somebody in some capacity. Okay. That's what's up.
Yeah. Yep. So then I did go to a university.
Okay.
I went to UAB, and but I was a party girl. So like I wanted to be in a sorority and all that, which I am now. But at the time I could not get right because I want to party. I'm talking about I'm going out Sunday through Saturday, drinking, turning up every day.
I'm tired.
I wasn't tired.
I mean, I ain't gonna act like I didn't do that in college, but that just now, I think maybe in my older age,
I can't do that now.
Sunday through Saturday, it just sound like a lot.
Every day. It was a lot. It was a lot. Yeah. And so like I didn't have to, but I made the decision to leave and go to like one of those little private colleges. So I went to Herzing University.
Okay.
It's in Homewood. And I did my LPN first, so that was a year.
Okay.
And then I worked as an LPN for like 2.5 years. Hated it. It was giving Hebrew.
Now what? So hold on. You gotta put me on to this new lingo, right? What that mean? Cause I gotta slave, right? Okay, that's what I thought. But I didn't want to be wrong with this thing.
I'm talking about slavery bad.
For real?
Mm-hmm.
So what made it so terrible for you?
First of all, you work in a nursing home, you got 30 patients on one card. Who?
Yeah.
You got to give all they meds, do they treatments. It was just ghetto. Nursing is ghetto, period. But that was ghetto. And see, I was never a CNA. So like I went straight in just doing that. But I just really got to see what it was. And then like sometimes, the CNAs work short. So I had to help them too. So it's, oh my God, like I'm wiping ass, like I'm doing all this. Like, did I really sign up for this night? Nothing against, because in a nursing home or really any job you work, like your aide is kind of the backbone for real.
Absolutely.
And like it used to be nurses being mean to them. And I'm like, they could really make or break your job.
Girl, I love my CNA.
Yeah, me too.
I really do.
I do. Yeah.
Well, yeah, we got, you know what? And I hope through this podcast and everything that we really help bridge that gap, because it'd be a little, it'd be a lot of smoke between us.
It do. And it don't have to be. It don't have to be. It don't have to be.
Because now granted, I had some that had their little tools.
They do.
But we're going to make it better. We're going to make it better because I love y'all.
Yeah, I do too.
Yeah.
Definitely, because you're doing what I don't want to do. Okay? And like that is enough right there. And like I love y'all so bad because you're doing your big one. Let's just put that out there. I ain't even being funny because let me tell y'all, like whenever a nurse don't want to do something and like, cause like in the ER, we had techs, but they was always busy doing other stuff. Mm-hmm. So it's like, if I could get out of wiping butt or like the GI bleed, like you got something you don't want to do this for me. And some nurses don't mind, but it's at the last of my list. I don't want to do it.
Yeah. And see, it's certain, like I don't mind doing it, but a lot of times it'll be like, I can't do this and that. And quite frankly, like I tell people, like especially conversations I had, like, it ain't all the time I want to have you do that. It's literally, certain parts of my job, I can't delegate to you. So, especially when they be having an attitude, I'll be like, wait, you do, that might be another episode. But you know what I'm saying? Like, that's a part of your job.
It is.
You know what I'm saying? But no, I feel you. Like, it's, just do it, please. Like,
yeah.
Please.
So, yeah.
Well, so,
LPN. Mm-hmm. LPN for 2.5 years. Went back for my RN. And that was another year because I got my associates. Okay. So bridged that. And then I finished RN school in, I think it was December of 2013. Was it? I'm lying. April or May of 2014.
Okay.
And then we got penned in May. And I took boards before we got penned. And so, of course, everybody was like, oh, my God, you took boards. How was it? Because I passed, period.
Congrats.
A smart one. Now, not to say if you don't pass on the first time, that does not mean you're smart, because I failed my NP boards the first time because I did not study. I failed it by 12 points. So let me just put that out there, okay? Yeah. So then I started off in the ICU, and then I ain't like it because I'm not a type A person. So like it was hard. They'd come in the room fixing my cords, messing with stuff. Baby, these are my patients. And then my preceptor, first of all, it's not a lot of Black people in specialty units. Let's just start there, okay?
You already know that's on the conversation.
Yeah. So my preceptor was snapping her fingers at me, like, you're not moving fast enough. And I'm like, I stood there and looked at her because it's like, girl. Mm-hmm. Who you talking to? Like, girl, I got a kid at the house. Like, I know. And she's like, oh my God, my best friend is Black. And I said, well, I didn't say nothing about that. I just said, you don't know how to talk to people. Like, why are you snapping at me? Like,
Yeah.
So yeah, after that, everything was good. Extra nice, extra help. Because it just take you one time to get somebody right.
But why it gotta be all? That'd be my question. Why it gotta be all that? Why we gotta even do this, Ruth? But you want it, so I mean, here you go.
Here you go.
Cause you're right. Cause after that, no problem.
No
I already know.
No problem.
I already know. So you was in the ICU. Yeah, I'm be honest. Like, I don't think I. So you saw me setting up, right? And I know you said
You'll fit right in.
my little, not my little, but
You'll fit in.
the MP has diagnosed me as type A.
I'm telling you.
But you know what? I'm not like that. No, in terms of like nursing, you talking about the cords and stuff. Like, no, I don't do all that.
It would probably bother you because I can see why it bothered them because it's a line for everything. And I mean, you got to label them lines. They all.
And it's really, I mean, critical. They very critical.
Yeah.
So, yeah.
So, I mean, I understood it. And I can actually see it working for you because, I mean, you got 2 patients, and I'm not even being funny.
Yeah.
Like, you got your 2 patients, and you just really locked in on those 2 patients. But people think, oh, it's easy because you only got 2 patients. You're really in that room every hour because you got to do mouth care, suction, you know what I'm saying? Like, neuro checks, whatever it is, you just always have something to do. So, I can see that for you. I can see that for you, friend. Because you real locked in on stuff. You fit right on in with them type A's, honey.
I don't know. I think it's different level of type A's, though. I don't know. You're not on what you just experienced. So if y'all wondering, she's like making a face, like, Because I mean, I had to set up, and I like things to be right.
Very particular.
Very.
And it's good, though, because I'm not.
Yeah, it's all good, though. I just wanted to be right for y'all, for the viewers, so y'all can see us, see all this melanin popping, and then that you guys can hear our lovely voices. So I just wanted to make sure it was right. But yeah, but I don't see myself going to ICU, though. I ain't gonna lie. I know a lot of friends who be trying to get in there. Why do you think it's so hard for black nurses to get in the ICU?
Because for one, they don't think we're supposed to be nurses anyway. They don't think we're smart. They don't think that we should have the same opportunities that they should have. I really feel like that. I really do. But that's why it's so important to soak up all the knowledge and gain a lot of skills and a lot of certifications so that your work ethic can speak for itself.
Absolutely. Absolutely. So is that kind of leads to the next question? Like, what made you kind of pursue, like, because you got your NP, like, what made you go that route?
The way that I saw Black patients treated in the ER. And as a nurse, you don't really have much say-so over their plan of care. You have to follow the doctor's orders. So as a provider, you have a little more say-so. And I mean, some states, nurse practitioners can practice independently. Because a lot of people will say, well, why the nurse practitioner route, not the PA? Well, PA can never work independently. They always have to work with a doctor. A nurse practitioner can work underneath a doctor, but if the patient is under your care, it's your patient. So you could take advice from the doctor, but at the end of the day, I'm signing off on this unless you just want to completely take over the patient's care. So that was a big factor because I wanted more representation of me.
Yeah. Because I was even, because my brother actually sees an NP, a Black woman. She's phenomenal. Shout out to Dr. Ebony Lyons in Birmingham, Alabama. She's phenomenal. I mean, she takes her time, even when I, have questions and, whatever about his plan of care, what we doing, but does an incredible job. But I remember looking up just at the statistics and how underrepresented we are for nurse practitioners. So
8%.
Exactly, 8%. And so my advice to anybody, my encouragement is, if you are, please pursue it. Now, for me, I'm going the nurse educator route, but that's because we also need representation there. But wherever you feel called to go, please do it. And do not fall for is oversaturated. I don't believe that.
It's not.
It's not. That I feel like that is a lie of the enemy. But no, we need to take up space for nurse practitioners for sure. So, but I commend you on going that route.
Thank you.
I really do. So from my understanding, you just started so tell the people about that. You just started somewhere. Like, what is that looking like that experience for you?
So I was working in urgent care. That was my very first job as a nurse practitioner.
Okay.
So I went PRN there just because of the hours. Like I loved the job. It was like a private owned practice
Okay.
or whatever. And to be honest with you, it was no Black providers, like none. But they were so nice, took me under their wing. I was talking about they didn't make me feel like a burden or like I was dumb. Like they was so happy to teach, and that was nice. And a lot of them started that practice. It was 5 ER doctors that started the urgent care practice.
Okay.
What I do now is I work for United Healthcare, Optum, and I see patients in the nursing home.
Okay.
And so basically the point of the program is to be treated in place to keep them out of the hospital. If we can. I mean, of course, there are some things. If a person is bleeding out, God forbid, we're not going to let them suffer in the nursing home. Like, you got to get a blood transfusion, right? But if it's like pneumonia or UTI or things like that, we can order a chest X-ray. We can give them steroid. We can do Lasix, you know.
Yeah.
So the nursing home is their home. So we just treat them in their home, and that's the goal. Yeah.
That's what's up. So is this, now I gotta backtrack to this video. Was that the same? That wasn't when the lady introduced you? Is that that same?
Yes, it is. It is.
It's that same? Okay.
It's the same.
So I'm gonna give y'all a soft introduction. So I saw this video of Bri, and she was just talking about her experience. Where I guess your preceptor was introducing you.
She was trying to introduce me to the administrator at my facility.
At your facility. And basically the administrator kind of just didn't really acknowledge your presence that much, right?
Yeah, she did.
And just kind of kept talking to your preceptor as if she ain't saying that.
Yeah, she was just like, because she was like, first of all, she ran up to my preceptor in the hallway because she seen her white coat. And I don't wear a white coat at work because I wear my Optum jacket and some cute scrubs, whatever. And she was like, oh my God, hey, like,
Yeah.
so nice to meet you. And she was like, oh no, I'm training Bri. You know, this is Bri. She's going to be the nurse practitioner here. And the administrator was like, oh, I don't even know what to say. That's what she said. I don't know what to say.
Yeah.
And what happened to the other one? She was like, well, she's still with the company, but
No, welcome, no, glad to have you, no, of that.
And so I was just looking at her like, I don't have a poker face. So I know my nose was twisted up anyway, because I'm thinking like, you like, I don't want that either. You know?
Yeah.
If we're being honest. So she directed her attention back to her, and I just started working on what I was working on because I don't care.
Yeah.
And then one of the staff members was like, oh, you gotta excuse her because she one of them. She wants those.
Yeah.
And I said, she was like, yeah, she's racist. I said, oh, that's fine. I don't have to deal with her. Yeah, I don't.
But see, I mean, this is why one of the reasons this platform was created. Like I told you when we was talking earlier, to create a safe space, because these are the kind of interactions we have to deal with consistently in nursing, and it's not okay. Because we come in spaces, and not all of us think like this, I know. But it's like, sometimes we feel like we do have to be better, but they get to be whoever they want to be that day.
Yeah.
Unprofessional. I mean, like you said, racist at the end of the day. That's just what it is, okay? And we have to keep dealing with that, you know, and it ain't right. Let's just call it what it is. And, I met a guy yesterday, older Black gentleman, and we were talking. And I had on the podcast shirt, and we were just talking about nursing. And he was like, man, all I know about nursing is that, the doctors be wanting the nurses. And I'm like, dude, number one, that's like, what?
That's TV.
That's TV. Number one. Yeah. But I was like, honestly, this podcast I created was to create a safe space for Black nurses. And I was like, because we deal with a lot of racism. He was like, for real? I was like, yeah, we do. He was like, I wouldn't have thought that, because every nurse I done interacted with, they all like, but see, that's a facade. And I think that's the thing, that because we are the most trusted profession. We, you know what I mean? People have this idea of what they think nursing is, but
it ain't that.
It ain't that. It's at the end of the day, anything that you see being represented in society, it happens in this industry. Granted, in the perfect world, we would like to think that, oh, because they're a nurse and they see different patients and from different walks. No. I think we deal with a whole lot of racism.
All the time.
All the time. So,
Microaggressions
all the time. So anyway, I could talk about this all day, but really, essentially, that's what it's about. And knowing that you've had this experience, we're here to validate it. This is the experience, but it's a safe space, and it don't matter at whatever level, even as a nurse practitioner, you are, you experience it. But, again, kudos to you for, stepping into rooms and being, just representing, you know what I mean? And whatever track you happen to be on, like I said, if you are thinking about nursing, if you're a nursing student, if you are pursuing a higher degree, keep going. All right. Just keep going. All right. And just know that, you got a community here who is counting on you. And that more than anything, you got patients who really want to see you do well. It's our people who want us. They need us.
They do.
They need us.
They do.
So keep going. I get off my soapbox because I keep going. But no, keep going. Seriously.
Yeah.
But I wanted to bring up that video because I saw you post it and I was like, and I think that might have been the video that made me, I said, girl, you gotta come on the podcast.
Yeah.
But that was the video. But yeah, I hopefully, she sees this video and realize
Hopefully.
it's not okay. And, if you want to sit at a round table, we can have discussions, but I really do want to change that in nursing. You don't have to be ugly. You don't have to be ugly. And nobody's coming to get your job, but we're gonna always be good. You know what I mean? Always keep striving and wanting to be better. You know what I mean? And so, keep going. But yeah, that was your experience there. But how's that job going? So
I love my job.
Yeah.
Yeah. I don't think I'm gonna leave.
Yeah.
Because it's like the perfect work-life balance. Like I feel like it revolves around my life and my life doesn't revolve around work. So that's perfect for me.
Good. So what's like a typical day?
So a typical day, now that I'm on my own, so like when I was with my preceptor, we would start at like 10, we'll be done by like 3.
Ooh,
nice, right?
Nice.
So now for me, a typical day is like I'll start between 8 and 10.
Okay.
And then like sometimes, I plan my day, but if a readmission comes, of course that's priority.
Okay.
Or it's called a TTS, which means that they're in the rehab facility short term and it's just a one-time visit.
Okay.
To where I'll see them and then they're gonna go home with home health once they finish their rehab. So like those take priority over just seeing. And then there's also like risk levels. So red is high, like you need to see them once a month. Yellow, you're gonna see every 2 to 3 months. And then green, I think every maybe 6 or every other, something like that. I'm still learning. But it's super easy. And like also what made me think or know that I would like it is that a lot of people have been there for years. Like my preceptor was hired from the company. She worked with them for 14 years.
Yeah.
So
that says a lot. I mean, ain't nobody leaving.
Ain't nobody leaving.
So it's a blessing then that you.
It is.
Yeah.
I feel like I looked up on it. Well, I ain't gonna say looked up because what's for you is for you.
For sure.
So God bless me with that.
Yeah.
Yeah. Because I'm talking about I used to be stressed out.
Yeah.
Yeah. So
Wow.
it's like a real soft girl job now.
And they say like soft girl.
Soft girl. Yeah.
Well, good. I'm glad. I really like that. I'm glad you got that. Yeah. That's good. And so, cause you're also a mom of 3, right? So I'm sure between the job, like it's a good balance for you. It sounds like flexibility too, which is important.
It's important.
It is very important.
It's Monday through Friday though. But it's no weekends, no holidays, no on call.
Ooh,
so it's good.
Yeah.
It's good.
I ain't gonna lie, I had my first 5-day week.
You didn't like it.
So for any of you who don't know, let me kind of backtrack just to say. So if you're not familiar with nursing, because I'm not gonna be naive and think everybody who watches is gonna be a nurse. Nurses, we got a cush life to some degree. To have work 3 days and be off 4, right?
12 hours. Tell me 12 hours is not a long time to be inside them 4 walls.
Stop playing. No, it's very long. Okay.
Okay.
It is. But what's even longer is a 5-day work week. So when I was a nurse educator on a unit, that 8 to 3:30,
That ain't bad.
5 days a week. That means I got to get up every single day to get in. I mean, I even left early, but it was just the knowing that I needed to be somewhere 5 days a week. You're counting on me to be at my job 5 days a week.
I love that.
Wait, what?
I love that.
You love that? Okay.
Mm-hmm.
No, it was definitely a challenge, but it was beautiful though. Like I had my own office. Like it had a lot of perks. So I'm not gonna just act like it was all bad. It was not, but that definitely was an adjustment for me. Like come 2:00, I'm like, oh my God, I'm so sleepy. Like what am I supposed to be doing? I had an office though, so
See, little nap.
nap. I believe in naps.
My lunch break. We're gonna take a nap.
I believe in a nap.
Mm-hmm.
100%. But no, like I said, so you get a lot of work-life balance, I'm sure, right? I'm sure your kids love that, right?
They do, cause I could pick them up, and like I can go to field trips, doctor's appointments, whatever I need to do. Like I can do it, and I don't have to. I mean, I let my manager know,
Sure.
just but I don't gotta stress about it.
Cause I'm sure. I mean, being a nurse and a mom, like that's a lot. But to know that you, like I said, that work-life balance, you got a lot of flexibility. You can be present for your kids. You don't have to miss things.
Yep.
You know what I mean? Cause I'm sure if you had, was there a point in time where you had to miss stuff?
Yes. I mean, like the urgent care, they'll work with you.
Yeah.
But it's not gonna always be somebody that want to come in all the time. You know what I'm saying? So it's just worked out.
That's such a blessing. I love that. I really do. So this kind of backtracking too. Like what has been your biggest challenge in nursing? Obviously I know that situation you had, but even in pursuing your degree, were there some, I guess even hurdles, whether it was doing when you were on the NP track or even when you were pursuing
Yes.
BSN?
I went through a whole divorce.
Yeah.
When I was in nurse practitioner school. Okay. And so that was hard. And then becoming a single mom. So like literally I was working nights at a level 1 trauma center. And it was like we was staying with my brother until my house got finished being built. So like of course he would keep the kids at night, and then but it's like when I got off, I literally had to go home, get them up if they wasn't already up. Because sometimes he would, but I don't expect him to because that's not his responsibility. So like get them ready for school, and then go to clinical right after. So no sleep after working 12 hours all night. It was just go mode. Like I really was just locked in. And so like a lot of people were like, well, when did you sleep? Sometimes I did sleep, or at clinical, I would sleep in my car for like between 15 and 30 minutes, a little power nap.
Let me tell you something about a power nap.
So energy drinks was my bestie.
Yeah.
Yeah, I had to do it. So
I do want to backtrack on something that you just said, because I need some clarification.
okay.
So you said when you got off, you get the kids ready, but you also said, is your husband at the time?
No, my brother.
Okay.
We stayed with my brother while my house was.
Girl, you know what I thought you said?
What?
I thought you said it was the ex-husband. It wasn't his responsibility. That's why I had to hit pause. No. Okay, but I forgot you said about the
my brother. Yeah.
Okay, y'all. I mean, look.
Selective hearing.
So she talking. No, I mean selective. I had missed the details, so I had to backtrack to make sure I didn't hear that. It was like, wasn't his responsibility?
Nah.
But no, it's your brother. Yeah.
Okay, no.
Okay, I understand now. Yeah. But yeah. So you get off, get them dressed, and like you was taking naps, and then live by energy drinks, which I take every nurse.
I'm talking about. It was a ghetto time.
Yeah. But you got through.
Persevered.
You persevered. That's the name of the game sometimes. Wow. I'm so glad you did though. You ever look back and be like,
how did I do it? All the time.
Yeah.
All the time. Yeah. So when I popped my stuff, I popped it because it was just not it just was not an easy journey.
Yeah.
Yeah.
Oh, that made Mara so happy. Like, nah, seriously, because it be like it's sometimes when you in the thick of it, it be feeling, and it's not even just speaking like you say, you went through a divorce. I think anytime we're pursuing something, like life does not just say, oh, we're gonna take a break while you pursue that. We'll come check back with you when you're done.
No, for real.
No.
Don't.
Life said, oh, we're gonna crank it up.
I'm telling you, and so many people told me like, well, maybe you should just stop. Like maybe this not your season. I kept going because
I'm so glad.
it's always my season. Even if it ain't my season, it's my season.
Oh,
I will make some shake.
Oh, that's good.
Like I'm the most ambitious, and I love a challenge.
Yeah.
Like you tell me I can't do something, noted. I'm gonna do it. Shut up. I'm gonna go get her.
Oh, that might just be, I feel like that might be just our superpower too.
Could be. It's not like anybody that know me, they like anything you say that you were gonna do, like you done it. And that's true.
That's so good. Mm-hmm. Oh, I hope that encourages somebody for real. Whatever path you on right now, whatever path you on, just do it.
Y'all do it.
You got it, man. Like I promise you, you got it. And I really pray that everything that Bree said has served as some encouragement, no matter what path you're taking. Like I said, whether you just starting out, you pursuing a higher degree, because you really. That's good.
And don't let people talk you out of it, like,
because they will.
They will. People say, oh, I make more as a nurse than a nurse practitioner. And that may be true at first. Mm-hmm. You're gonna take a pay cut, but you gotta think about the long run. 2-3 years in the game, you're gonna be making more than you was as a nurse, and you're not gonna have to kill yourself doing it. Now there are some soft nursing jobs. I'm not saying that, but
I ain't gonna lie, I'm looking for them soft nursing jobs.
Occupational health,
it's challenging to even get in that. Like, please put me in the occupational health.
They don't leave.
That's why I can't get the job. Cause none of y'all leave. Y'all please leave.
Listen.
Cause all I wanna do, I wanna give y'all flu shots and all of that. Y'all TB shots. That's it. Yeah. And then go home. But then again, hold on, that's a 5-day work week, ain't it?
Yeah. But you got that.
So for you, what is a piece of it? Well, you kind of just said it. Honestly, who needs this? She actually cheated because I gave her some little prep questions. I was okay not knowing that.
Oh.
I did all that work.
I glanced at them, but I didn't study them.
No. See, I would have been the one.
See? And I would never send them to you. I wouldn't, because it would be too rehearsed. You want authentic.
But you know what? That's what I was going for. This was just more of a guide.
Mm-hmm.
It might have just been more for me than you anyway.
That's fine.
Wait, so you didn't look at them?
No, I did. But I didn't like thoroughly look at it. I probably looked at, my attention span is this big. And so like I probably looked at the first 2 questions and I'm like, oh, okay, that's cool.
But you didn't read down to number 11?
I didn't.
Oh, okay.
So you gonna probably catch me off guard with some.
Hey, that might have been the teacher in me that be like.
But I appreciated it because it put me at ease, because I was very nervous. I'm not gonna lie.
For real?
Yes, I'm telling you.
Why? Because she wasn't giving nervous on Instagram. It's Nurse Bri was not giving nervous.
I know.
It was giving.
Mm-hmm. Yeah. I'm a shy person in real life.
Mm-hmm.
Yeah.
That was just her Instagram persona.
Mm-hmm.
She ain't shy.
Okay.
It's been cool.
We've been good.
She just won't admit I have good energy. Just how she was talking about.
I said she did.
You ain't say it on camera to people.
She has good energy.
That's why she couldn't give me attitude at the gas pump. Like, why is this girl talking to me?
No, I sure was. I was like,
that is so funny. I ain't gonna look to get that. But yeah, man, like I did tighten these up because I was like, well, at least let me give her some like guys. But it was not for us to be. Like I said, it might just be more for me at the end of the day, and I'm okay with that. But if you could give any piece of advice, which you kind of really spoke to it in a way already, to any Black men and women who are thinking about pursuing nursing, what piece of advice would you give them, other than don't let anybody talk you out? Or is that the advice?
No. I would say that know what you're getting yourself into, because what you see on TikTok and Instagram and all the cute uniforms and getting ready, it's not really what it is, okay? Like you're really dealing with people's lives, and some of the people you work with are gonna be mean, period. And nursing is very cliquey. It's very ghetto because, and I'm not saying this to deter anybody, I'm just being honest. A lot of people just are not honest. Y'all don't know what y'all getting yourself into. And it does not pay what y'all think it pays coming fresh out. So there's no money, okay? You are a social worker, a janitor, you're an A, you're everything.
Got it.
I'm talking about everything, and you really have to like it. Like, you have to want to care for people. I feel like it's a calling. And like when I was a nurse, I got satisfaction out of listening to people. Whether I used to have some really, really grumpy patients that nobody could deal with but me for whatever reason. But a lot of times when people rant or fuss a lot, they just want you to shut up and listen.
That's it.
And sometimes we get so caught up in doing all the nursing things and, oh, I got to do this and hustling and bustling around, that the patient don't feel like you care. So I used to have to take time out of my shifts, and I sit there for 15 or 20 minutes, and I'm loved. I'm a love nurse. So
I love it.
It be like that. Or like real difficult family members, like you have to know that you could be the patient one day. This could be your mama or grandma, dad, and you got to treat people the way you want to be treated. That is my golden rule. I know y'all parents taught y'all that. Treat people the way you want to be treated, because anything can happen.
Anything, for sure.
So yeah, that's my advice.
That's good. I'm glad you said that, because, you know, a lot of us who have been nurses prior, like way before COVID, a lot of us had the same conversations, like really kind of hate what COVID did.
Oh, yeah.
It's like it created this false like perception of what nurses is, and it really attracted a lot of people who thought like, I don't know, it's just glamour and buying
Figs. I just bought my first pair of figs.
Huh?
I just bought my first pair.
Yeah. How they fit?
They feel good. It's a jumpsuit.
I ain't gonna lie, I did see you in a jumpsuit. I was like, oh, I gotta get into the jumpsuit.
I love
I could see myself wearing a jumpsuit.
I love it. My mechanic suit is what I call it. But I like it.
Yeah, I like that too. I'm gonna check it out. Cause I be concerned about some of these screws. They gotta fit in the right places. Cause if y'all know, we built,
Yeah. You got hips and stuff. Yeah.
all that, and it gotta fit right.
Gotta fit.
But yeah, nah, that's some really good advice though. Like, get into it for the right reasons, y'all. Cause I'm gonna be honest, even if you did, even the ones that come in and they do it for the money, you're not gonna be here long. Baby, you're not. Cause let me tell you, I'd have made a boatload of money in nursing. But I also I had to take some breaks to. I'm like, you know what? So and that was when I was making a lot of money. So the money is,
It'll come with experience.
it'll come with experience, but it's not enough to keep you. And I think that's for any line of work you in. You gotta be passionate. And I'm very passionate about people.
Yeah.
You know what I mean? So it's time. When I first came into nursing, I was making, I think I was making $32 an hour. Maybe, and the only reason I got a raise because I switched to night shift.
Yeah. I was making 32.
Yeah.
Pennies. Well, let's not say pennies, because I was making less before that. But for all the work you gotta do,
yeah,
it ain't enough.
Yeah. And I think that's the thing too. Like, I mean, I do believe in the beginning. What? I ain't gonna lie, I do feel like they still could pay a little bit more though.
It could. And people are like, all y'all care about is the money. Who doesn't? What do we go to work for? What do we go to work for? Money. So we could pay our bills, so we could survive. So like, why are y'all mad that nurses want more money? Like, I want anybody who thinks that nurses don't deserve more money, I want you to work as a nurse for a day. And see, you wouldn't even last the past 2-3 hours. I'm telling you right now.
It's rough. It always rough.
So
let me tell you, it's rough, and I work in a place that everybody does their job. So it's really like nurse, like utopia. Like it's really just ideal.
It's like unreal, ain't it?
Unreal. I'd be like, oh my gosh. And then so the people that work there and they be complaining, I'll be like, you ain't been nowhere. You ain't seen what's out there.
Yeah.
You know what I'm saying? So it's just, man, yeah. But anyway, yeah. I probably cut this little part out. What was I gonna say to you?
My brain fall.
Fall, straight fall. Actually, I ain't cutting this out because it's going live. How we both get brain fog?
I'm telling you, I get it so bad. It's bad. It's real
I
bad.
need some omega-3. That may not even.
That help.
Apparently, it's supposed to. The omega-3.
Or lion. What's it called? Lion's mane. Yeah.
Everybody. Lion's mane. Oh, but you know that Rise coffee they say is supposed to help. You drink coffee?
Mm-hmm. All the wrong ones. Starbucks and
Yeah. Starbucks is not no real.
Dunkin'. Dunkin's strong as hell.
No, it's not. You know, the only way Dunkin' gets strong is if you put an espresso shot in there, a turbo shot.
Mine be strong. The one by my house, I'm talking about, it don't have no.
You talking about the one by the Shell?
Yes, that coffee be strong as hell. It don't have no sweetener in there.
You drink black?
No, I get the caramel craze. And it's strong. It don't taste like nothing.
My mama actually stopped going to the Dunkin'.
Wow, they rebottling it.
Because I think she done been through so many people there, and it's like, who y'all keep hiring to work in this place? Because
I had my favorites. They know me by name.
yeah, so it got to be her favorite one there. But I think it was probably a string of events to where it was so inconsistent. It was like, you know, I'm just not gonna go no more. I'm gonna go to the one on Acton Road. Or I'm gonna go to the one. What's the other one? It's another one. I can't call it right here, but it's a lot of them. But no, I like Dunkin'. But that was some good advice though. That was some good advice. Yeah, don't go into it for the money. But how important is mentorship in nursing?
I think it's important because to have somebody that you can like vent to, talk to, give you sound advice, because, well, I've come a long way, but I used to be very impulsive, very crash out, very say what I'm gonna say, and I don't care. This job,
Bleep, 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 bleep.
yeah. So, I think it's important to have a mentor, just because, like, especially starting out though. Yeah, it is important. It's important.
You currently have a mentor?
No, I don't have a mentor. I had one when I was a LPN.
Okay.
I didn't have one like as an RN, and I didn't have one when I was going through NP school. I mean, of course, like me and my friends talked about stuff, but I didn't just have like one specific person. I mean, not my mom. Now, my mom will always give me sound advice, like when I used to be ready to crash out. But eventually, me going off at those jobs cost me like contracts, and like you can't work for us no more. So like eventually I had to learn, because like, okay, now you messing up your money. So
Things hit them pockets is different.
it's different. Hit different. It hit different. Yeah.
So with that being said, I guess there was, you know, some lessons you learned along the way.
Mm-hmm.
Well, you'd be a great mentor. You know that, right?
A lot. Some people have asked me to mentor them, and I'd be like, me.
That's okay, because I'm about to plug right now. So the bedside report, we are going to be offering mentorship to nursing students. So
That's good. I love that for y'all. Okay, let me be serious. Say it again. I'm gonna be for real.
that was your yes. That was it. That was your yes.
Voluntold.
Voluntold. There you go.
Okay.
No, but no, that's a part of the bedside report for sure. We're gonna be opening up mentorship. So we'll love for you to apply.
Yes. Okay. Just let me know when it starts, because clearly I don't have a choice.
No,
That's fine.
no, no, because I think it's people who really need your realness, your rawness. You know what I mean?
But what I tell you before we started, what I say?
He said you was ratchet.
Look, I'm a little rough around the edges. I am not what what you would call professional. I don't like the word. I'm not that. I'm not that. I do my job. I do it well, but I'm gonna be me every time.
This is the perfect segue into what I really too believe is important though. You know what's so crazy? Our patients, they need that. That's why I think we ain't know just one. That's why I love being Black.
Oh yeah,
Cause that's what our patients need. They need us to be exactly who we are.
and I fuss at my patients.
You know what I'm saying? Like they need you to be exactly who you are.
Mm-hmm.
And so don't change that. Don't change that ever.
And I won't.
You know what I mean? I think again, when we think about the profession of nursing, you got to think about who's been pushed to society as in terms of what a nurse looks like.
Yeah.
You know, what do we say? The blonde hair, blue eyes, consistently is what we have seen. And guess what? Our patient demographic ain't that.
No.
Ain't that.
Right.
And they need us to show up authentically because they're able to receive things differently. They hear differently when they know if somebody look like them can speak their language. So keep being you. If y'all out there, keep being who you are. Keep being who you are. Your patients depend on it. And I'm gonna say that a million times. But yeah, Bri will be available for mentorship. I'll keep you all updated on that. She was voluntold. But we got it coming down the pipeline. If you're interested in being mentored, I actually got a few people lined up already. But if you're interested in being mentored, definitely message me. I just keep following because I'll have more information available. But yeah, mentorship is amazing. You know what I mean? Like I had somebody, I've had a couple mentors simultaneously and they all gave me something different. So it's just important to be mentored, and especially in this profession.
Yeah, I agree.
Yeah, so that's cool. But so we're gonna lighten it up. I mean, all that was good. What's your biggest ick in nursing?
The clickiness. That's really what it is. Like the mean girls, the liking to watch your coworker suffer, because at the end of the day, you're really only hurting the patient.
Hurting the patient, yes.
So it's like, but I'll suffer in silence. Like I'm not about to be running up behind nobody. I will prioritize, and I have ADD. But when it comes to that, and I see how y'all moving, I prioritize and work my way on down.
Yeah.
And you'll be surprised. Oh, how are you sitting down? I've been running around since the shift started.
Yeah.
Oh.
I ain't gonna lie. I do feel like it's a lot of them like who not only like to see yourself, but they want to see you drown. But be so surprised
That
like,
you held it down.
How you still? I actually had a nurse say to me last week, she's like, I just don't know how you do it. And then I'm just like, Ernest, I told her straight up. You know, sometimes you really gotta pop your.
You gotta pop it. Pop it.
I was like, I mean, I've been a travel nurse, and I basically said, like, this ain't really nothing. Y'all really spoiled here.
I'm telling
Y'all ain't been nowhere.
I ain't been no trenches for real. Where you don't have supplies, where you don't get a break. Like you don't get a break. The whole 12 hours you don't get no break.
Yes, I thought I said, honestly, I was like, this really ain't, not because it ain't nothing, but it really ain't nothing compared to where I've been. So yes, is it super busy here? Absolutely, but it's manageable. You know what I'm saying? I could never. A lot of people say I could never do travel nursing. I'm like,
You gotta have some thick skin.
That part. You gotta be able to hold your own. I even got a friend, when I sat down with her, she said one of the girls had changed her drips. So that's we'll do a travel nurse episode too for things to look out for, because unfortunately you got people who really want to sabotage you. It is, again, it only hurts the patient, but
most hospitals are tech savvy, and if your pumps communicate with the computer, it'll show on your flow sheet.
I ain't gonna lie, but they got places that, well, see, the places I've been, sometimes that feature works when you scan the pump and it go, but a lot of times, I'm gonna be honest, it's 50-50.
Yeah.
And you got a manually program, so. But yeah, we're gonna do an episode on travel nurses and what to look out for, because you really gotta be on your game. And that kind of leads me to my next point, if you a new nurse, please, y'all, please get a good foundation. Don't hop into traveling. That is not a world you want to hop. Don't jeopardize your license and don't jeopardize your sanity. But most importantly, don't jeopardize your license. The money, it'll be there because that's not even the most important thing. You need a good foundation. Because I did 2 years where I was when I first started out. I did 2 years, and honestly, I'm so glad I got that good foundation. Cause I started at Emory's. I had a great foundation, and it was a terrible work environment. It was very toxic.
Oh yeah.
I was terrible. I wanted to quit.
Yeah.
I wanted to quit, but it was such a good foundation that I'll never forget. One of my night shift charge nurses, a black man. He said, "Oh, you gonna make it in travel nursing," and I always knew I wanted to be a travel nurse too. And once he told me that, because this is somebody I respected on the floor.
Yeah.
And once he saw it, he's like, "Cause you hold your own." I was like, "I'll bet. I was gonna be a travel nurse, so I'm gonna go do it."
Yeah.
So when he said that, I was like, "All right." And that's when I think I only had at that point like maybe 5 months left. So I had started looking. So I was ready to travel. You know what I mean? So again, that's another reason it's important to have us in spaces and pouring in and planting those seeds of, okay, you ready. I wasn't even looking for him to say nothing, but you know what I mean? When somebody is giving you a wealth of knowledge and they see things and they know what other nurses do and they look at you and they're like, oh yeah, you ready? Man, I was out of there. I ain't a little bit. Period. A little bit. Man, this has been a very like fun interview and I really appreciate Bri for taking the time out to come chat with us, to share her story, to share some of the challenges she has faced. And like I say, most importantly, your wins and your successes. And you're going to keep winning. You're going to keep succeeding. Like, I really feel like you just getting started. You know what I mean? And I know you think that too, because it's so much more. You know, you got this scrub line. I do. You got a lot coming. A lot is coming down the pipeline. So I'm excited for that. And no, again, I really do appreciate you taking time to come chat. We didn't cut up. I had a good time. I loosened up a little bit because, you know, she had said I was a little tight, you know. Nah, man, I just wanted it to be right. You know what I mean? Like I did.
It was perfect. It was perfect.
Oh,
without all the extra.
What's the extra?
The uptight.
Nah, man, I just wanted to be right, man, because we got to, make sure light, the sound, all that. But nah, I'm glad you enjoyed your experience. But so tell the people where they can find you.
Really, TikTok, YouTube, Instagram, it's all the same. It's Bri the MP.
It's Bri the MP. Make sure y'all go follow, okay? Go follow. It's Bri the MP. And look, that's it. I hope you guys, have been able to take some away from our conversation, something encouraging that can help propel you forward on the path that you're on. Again, be looking out though for mentorship. And if you have any questions, anything you would like to see us address with her or the next guest, and as we prepare other episodes, let me know. Until next time, love y'all.